Hi everybody, I'm suddenly nervous. I'm Louise, I'm one of the neuro-oncology clinical nurse specialists based at Hull Royal, and I'm based within the Department of Neurosurgery, but I work in neurosurgery and oncology, and I follow the patients through their hospital journey and outpatient journey and follow-up and on, etc. I've got 3 slides, one about positives, one about concerns and one about issues. I think issues and concerns sort of are along the same line really. Echoing what Mr. Ashwal said really, one of the positive things that we've got in Hull is we've got a really good team of specialist people, dedicated, highly skilled, and we work well together as a team. There's no sort of us and them between any different professions, and we all have regular contact with each other. All of the consultants are very approachable and easily accessible all of the time, and the same goes for everybody else in the team really. The second point also that Mr. Ashwal said is that we've got a really good pathway from neurosurgery through to oncology. So a patient will come in and have the surgery, the case will be discussed at the team meeting on a Friday, pathology results, if they're available, will be discussed. They'll see the neurosurgeon on the Monday or Tuesday, and then the oncologist on the Wednesday or Thursday. And if possible, if they need treatment, radiotherapy and chemotherapy treatment, they'll start their planning for that treatment on that day when they see the oncologist. So it's a very quick throughput of patients through that part. Once they're diagnosed, that bit happens really nicely and streamlined and efficient. Another positive thing is that being a clinical nurse specialist, I've been in post for quite a long time now, probably about 14 years, something like that. But I've got the consultants that I work with, I'm allowed a lot of autonomy, so I'm able to bring patients in for review early if they need it. I'm able to see a patient and assess them myself. I'm a prescriber, so I'm able to alter medication for patients. Everything I hasten to add is done in conjunction with the consultant in charge of patients' care. But it enables us to get patients to the right place at the right time for the right care. So, we can admit people to hospital, change appointments around, order scans, order bloods, all that kind of thing, which hopefully sort of smooths out the journey for patients. And the other thing that I think is really positive, it's been a massive difference over the last 18 months, is the Macmillan Brain and CNS Therapy team, because that has just added that extra expertise to our MDT, enabling people to stay at home, get quick access to specialist therapy inputs, equipment, etc. And a big contribution to our rehab and non-surgical MDT, which we hold weekly as well. And another positive, I've got lots of positives, but these are the main ones, is the Brain Tumour Support Group, which has been running nearly 2 years now, is it, Ali? Can't remember.
Yeah, coming up to 2 years.
Yeah, there's been a demand for a long time. Patients have been asking for local support groups, and we've finally managed to get together with the Brain Tumour Charity, who really we couldn't manage without in terms of running the support group. The charity and the patients actually run it, and we attend really and provide input. We talk about different subjects if patients have got particular things they want to know about, and it's running really well. Unfortunately, I don't get to go as often as I'd like to. My concerns, which echo probably some of the things that Alison said at the beginning of the day, are that unfortunately we've got a very small team of clinical nurse specialists. There's myself as the Band 7 nurse, and I've got 2 Band 6 nurses working a total of 43 hours, just over a full-time Band 6 post, for all the patients who come in to our system with brain and CNS tumours. One of the Band 6 nurses is very experienced. It's my colleague Lynn. She's just retired and come back part-time. and I've got a new girl who we're training up at the moment called Holly. So, because we work across 2 hospitals, we haven't got the resources really to cover everything that we need to in terms of being there for patients in clinic. Clinics are Monday to Thursday every week, morning and afternoon. We have MDT, we cover 3 MDTs, and we try and see patients on the wards as well. So, and deal with telephone calls coming through. So it's very difficult to actually cover and provide the support and information that every patient needs who's coming through the service. Another concern is that there are limited numbers of palliative care beds across the region, especially for respite care for patients. In general, we deal with patients. Some of our patients are elderly, but there are a lot of young people who come through, and nursing home places for young people are very limited. And trying to get somebody into a hospice bed is increasingly difficult for respite care. There are waiting lists, and even for end-of-life care, it's people talk about preferred place of care. We did have palliative care beds in the hospital trust at Castle Hill. Unfortunately, we no longer have those. So I think that is a concern really. And my other concern is that the Macmillan Therapy team are coming to the end of their funding. It's vitally important that we secure funding to continue their projects and their part of the team. Issues. Investment throughout the whole process really, community and hospital, is needed. We talk about small numbers of patients coming through the system, but patients with benign brain tumours are followed up for at least 5 years, and sometimes longer. So you're looking at possibly up to 10 years follow-up for people. People are surviving longer, they're coming back to the hospital for more complex treatments. They're just living longer, so they're getting more complex problems, and they're often living with more disability. And I've got to stop, I've got my red card. Time is the next thing. Is it time for everything, time from diagnosis to treatment, time to see everybody, etc., etc. Education, training and succession planning, it's got to be there, and again that comes into the time thing. We just don't have time to go and teach everybody all things we like to, look towards the future.